Hi everyone, my name is Anthony Lang, and this is week 5 as we discuss discrimination on ethnic um, from a patient to a medical staff. Uh, and reviewing our article for this assignment was patient caregiver preference. Touch base a little bit on this was we had a mother of a child who needed medical assistance, take the patient to the nearby hospital, and after being evaluated and admitted into a room, she did not want the nurse any longer because the nurse was not of a Caucasian descent. In doing so, the nurse immediately went to management, nurse supervisor, who went into the CNO and HR. Um, so, as the director of nursing or the human resource director, my recommendations for handling this type of situation is to immediately pull everybody away from the situation. One is to, in the meantime, look as stated in the article for any policies or procedures that we may have as a company. Talking with the team and then elaborating with them and letting them know that unfortunately at this time we do not have a policy in place to protect the staff and such a request, that we can accommodate that currently and we will accommodate it, and we will talk to the family and let them know and advise them that at this time we can accommodate the request. Taking and talking to the team, I would ask them moving forward that anybody that goes in that may have to answer the call light, whether they are Caucasian or not, they go in with a witness, so that way they're not being roped into anything, and to potentially avoid any litigation risk that may come up. In adhering to the patient's request, um, that impacted the providers or the people involved, I would talk to the loved one and reiterate that the fact that we are a hospital and that we are a company that takes pride in vetting all our employees, and that they have been through the challenges, the required fields and skills tested by the state to make sure that they can provide these adequate medical procedures that, if necessary, and that we are equipped to handle any situation no matter what the color of our skins tend to be. Sometimes family needs to be spoken with and explained a little bit more. Um, we are in a new era, and we do not have just a hospital for specific races or hallways dealing with specific races, specific religions, and men versus women as well. And drafting a sample policy um, statement and plan to address the future occurrence of such requests, um, I would discuss in the new policy that we as a provider have the right to talk to the patients and to offer them another place to go if this is not what they would like. Although we want to be as accommodating as possible, that once again our employees are vetted and they are have taken their proper techniques and schooling and education to get to where they're at, and because of the um, color of their skin does not prevent them from providing the great care that we have set for expectations. Some of the policy would also consist of how to handle such situations, which would immediately remove yourself from the situation, immediately go get a manager, a supervisor, and from there on, obviously, to continue moving up the ladder. And when we immediately have this type of situation, it automatically goes into every time the call bell goes off or the family has a request, we make sure that there is a witness and we are documenting in the patient's file, folders, or chart to make sure that nothing comes up and that we remain litigation free from a situation like this. Thank you.